Welcome to Roadmap to Residency. Hello everyone, I am Abhiraz. Welcome to our Club 250 Matchmaker sessions. We will be running through some questions with you guys to help you on a journey to a 250. So, which of the following is the primary inflammatory mediator responsible for the acute symptoms in these patients? A 55-year-old man presents with sudden onset severe pain and swelling in his left first metatarsophalangeal joint. He reports a history of occasional alcohol consumption and a diet rich in purine containing foods. On examination, the joint is erythematous, warm to touch, and extremely tender. Synovial fluid analysis reveals needle-shaped negatively birefringent crystals. Which of the following is the primary inflammatory mediator responsible for the acute symptoms in this patient? Interleukin 1, tumor necrosis factor alpha, interleukin 6, interleukin 8, and prostaglandin E2. The clinical presentation, including sudden onset, severe pain, swelling, and erythema in the first metatarsophalangeal joint, along with the identification of needle-shaped negatively birefringent crystals in the synovial fluid, is characteristic of acute gout. In gout, monosodium urate crystals trigger an inflammatory response. The primary inflammatory mediator responsible for the acute symptoms in gout is interleukin 1. Now, interleukin 1 is released in response to the presence of urate crystals and plays a central role in the initiation of initiation and amplification of the inflammatory cascade associated with gout. Therefore, the correct answer is option A, interleukin 1. So now let's review the first part of the gout. So gout is an acute inflammatory monoarthritis which is caused by the precipitation of monosodium urate crystals in the joint. Now the picture that we are seeing here, now this picture is very, very important. Now this yellow and blue, or you can say pink and blue crystals, these all are same, but the thing is that there is alignment of the crystals towards the light. Okay, so different alignment gives different uh, color. So you can see that yellow under parallel light and blue under perpendicular light. So these are the same crystals. These crystals are not different, but the only difference is that their orientation towards the light. So now this picture is very, very important and maybe the only clue sometimes to diagnose the case. The risk factors include male sex, hypertension, obesity, diabetes, dyslipidemia, and alcohol use. The strongest risk factor is hyperuricemia, which can be caused by under-excretion of uric acid, largely idiopathic, potentiated by renal failure, can be exacerbated by alcohol and certain medications. Overproduction of uric acid, Lesnian syndrome, PRPP excess, increased cell turnover, von Gerke disease. Crystals are needle-shaped and negative birefringent under polarized light. Serum uric acid levels may be normal during an acute attack. Now, asymmetrical joint distribution, joint is swollen, red and painful. So obviously acute, the joint will be swollen, red and painful. Classical manifestation is painful MTP joint of big toe, which is also called as podiagram. There is tophus formation. Okay, you can see under the joint there is this hard substances. Now these are called the tophus, often on external ear, olecranon bursa, or Achilles tendon. Acute attack tends to occur after a large meal with foods rich in purines, like in our patient. Trauma, surgery, dehydration, diuresis, or alcohol consumption. Now these the predispositions causing acute attack are very, very important for the gout. Now, the questions in the USMLE step 1 does not give you a simple or chronic gout sort of questions. They typically ask you an acute gout scenario. Okay, so now that's why you need to know the factors that trigger the attack of acute gout. Now, because that's what they're going to test you on examination. So now there is decreased uric acid secretion and subsequent buildup in the blood. Acute NSAIDs, the treatment for acute gout is NSAIDs, glucocorticoids or colchicine. Okay. Now here also you need to remember that you cannot give NSAIDs in case of chronic kidney disease patient, but colchicine or steroids is rather safe in those sort of patients. Chronic xanthine oxidase inhibitors like allopurinol or febuxostat. Now, the questions may be testing on you about acute gout, but maybe also mentioning you that the patient is having chronic kidney disease or some sort of kidney condition. Now they know that you know the treatment of acute gout as NSAIDs, but they also want to test you that NSAID is contraindicated in case of renal insufficiency or renal diseases, and they want you to choose colchicine or steroids, okay? And they will typically keep NSAIDs as an option in the first number, okay? Option number A. Now, which of the following minerals is most likely responsible for the crystal deposition in this patient's joint? And 70-year-old woman with a history of osteoarthritis presents with acute onset severe pain and swelling in the right knee. She denies any recent trauma or excessive physical activity. On examination, the affected knee is warm, erythematous, and markedly tender. Synovial fluid analysis reveals rhomboid sept positively birefringent crystals. Which of the following minerals is most likely responsible for the crystal deposition in this patient's joint? Monosodium urate, calcium pyrophosphate, hydroxyapatite, calcium oxalate, or calcium carbonate. Now, the clinical presentation including acute onset severe pain, swelling, and erythema in the knee, along with synovial fluid analysis showing rhomboid sept positive birefringent crystals is characteristic of pseudogout, now also known as the calcium pyrophosphate deposition disease. Now, the crystals seen in pseudogout are composed of calcium pyrophosphate dehydrate. Okay, now therefore the correct answer is calcium pyrophosphate. Now, let's review with me the CPPD disease part from the first state. It is formally called as pseudogout. The deposition of the calcium pyrophosphate crystals within the joint space, uh, and it occurs in patients more than 50 years of old. Both sexes are affected equally, usually idiopathic, sometimes it's associated with hemochromatosis, hyperparathyroidism, or joint trauma, pain and swelling with acute inflammation, and chronic degeneration, pseudo osteoarthritis. Most commonly affected joint is the knee. Chondrocalcinosis or catalyst calcification on X-ray. Crystals are rhomboid and weakly positive birefringent under polarized light. Okay. Acute treatment is NSAIDs, colchicine, and glucocorticoids. Again, remember that NSAIDs cannot be given in kidney patients. Prophylaxis is through colchicine. Let's do one more question here. Now, which of the following organisms is the most likely causative agent of this patient's septic arthritis? Okay, a 45-year-old man with a history of type 2 diabetes presents with a 3-day history of swollen red and extremely painful knee. He reports a recent skin abrasion on the same knee. On examination, the knee is warm, erythematous, and has a limited range of motion due to pain. Physical exam, synovial fluid analysis reveals a white blood cell count of 40,000 with a predominance of neutrophils. Gram stain of the synovial fluids shows gram-positive cocaine clusters. Which of the following is the organism responsible? Staph aureus, Strep pyogenes, E. coli, Pseudomonas aeruginosa, or Haemophilus influenzae. So the clinical presentation is suggestive of septic arthritis. The most common cause of organism is Staph aureus. Okay, now let's review with me the septic arthritis part of the first aid. Now, Staph aureus, Streptococcus, and Neisseria gonorrhea are the common causes. Usually monoarticular, that is affected joint is often swollen, red, and painful. Synovial fluid is purulent. WBC may be more than 50,000 per millimeter cube. Complications, osteomyelitis, chronic pain, irreversible joint damage, sepsis, treatment antibiotics, aspiration and drainage to prevent the irreversible joint damage, disseminated gonococcal infection, STI that prevents as either purulent arthritis or triad of polyarthralgia, tenosynovitis, and dermatitis. Thank you for watching. Keep studying.